Good afternoon, everybody. Really, I am very much thankful to all research persons, those who have participated in today's webinar on the topic effective homeopathic medicines in influenza and COVID and like illness. Almost 10 homeopathic physicians from different parts of our state, they have sincerely contributed their personal experience, practical experience during course of treatment, and after thorough discussion and brainstorming discussion for about 1 hour, it revealed that in most of the cases, arsenic, Bryonia, Rastox and Eup-perf perfoliatum was indicated as most effective homeopathic medicine in recent influenza and COVID-like illness. And in the selected cases, some of them also narrated, a diagnosed COVID case has also been cured with homeopathic medicines. In short, I do like to emphasize that only the individualistic approach of homeopathic treatment would be the key points to success in homeopathic practice, as well as to give relief persons, those who are suffering from recent pandemic, or rather COVID and COVID-like illness. Now I am taking the privilege and opportunity to share my experiences, especially among these 4 medicines, arsenic, Bryonia, Rastox and Eup-perf perfoliatum, comparison and differentiation from prodromal stage to apyrexial stage, generally what symptoms we are getting. Now, first of all, if it be possible, when in any family anyone is suffering from this fever, the rest of the family members, as they are being exposed to that particular person who has already been affected, the chances of being suffering is more. And when they are suffering, in initial phase they may develop some prodromal symptoms only, and if we catch up the prodromal symptom in early stage of fever, then the fever would be aborted at the very beginning of the starting of the complaint. So first of all, I do like to illustrate on the prodromal phase, especially comparison in between, rather among arsenic, Bryonia, Rastox and Eup-perf perfoliatum. All 4 medicines in prodromal space, they are having yearning and stretching with malaise. All 4 medicines we are getting. In arsenic, yearning is more, stretching is less. In Bryonia, both stretching and yearning almost similar. In Rastox, yearning is less, stretching is more and more. In Eup-perf also, yearning and stretching is both are more. But in arsenic, along with yearning and stretching, we are getting weakness and debility, rather great weariness and inclination to lie down. Another important symptom I have repeatedly clinically verified, I do like to request you, if you have this symptom, or you may also make retrospection, patient those who have been suffered from this type of illness and is being recovered with arsenic, A beautiful prodromal symptom, sleepiness night before the paroxysm. The very beautiful symptom we may get, sleepiness night before the paroxysm. In case of bryonia, along with stretching and drawing in the limbs, violent headache. Headache may start when there is no fever or pyrexia, with great thirst for large quantities of cold water, with very lassitudinous and weariness. Along with, there may be stitching or jerking pain throughout the body. Vertigo also may also be present, and having inclination to lie down and feeling better while lying. In Rhus talks we are also getting yawning and stretching, but in bryonia we are getting severe headache. In Rhus talks also we are getting severe headache, along with pain throughout the body, not stitching character, generalized aching rheumatic-like pain, weariness of the limbs, and burning in the eyes. Two important prodromal symptoms is characteristics for Rhus talks: aching pain all over the body, yawning and stretching, along with burning in the eyes, painful weariness of the limbs, and increase of saliva in mouth. In selected cases, dry, teasing, fatiguing cough may also start during prodromal stage, which may continue and aggravate during chill. In eupatorium, already I have told, yawning and stretching is almost in a similar magnitude, but the characteristic symptom we are getting, not generalized pain like Rhus talks throughout the body, not localized pain, headache like bryonia, pain localized mostly in the back, especially over right ilium and bones of extremities as if broken. There is a peculiar sensation in eupatorium parpoliatum. In Mathemedica we are also getting bone aching pain. Patient is also telling and narrating the severity of the pain and nature of the pain as if it is bone aching pain, bone breaking pain. In eupatorium, in selected cases, we may also get sick stomach and thirst, feeling thirsty night before the paroxysm. Eupatorium is also insatiable thirst, taking water but not feeling any relief. Rather, eupatorium parpoliatum patient not able to take more water, as drinking causes nausea and vomiting, and that also invites and hastens the chill. In Rhus talks, another important point we should mention during prodromal stage it may present, that is insatiable, unquenchable thirst with a subjective dryness feeling in the throat, though taking water but not feeling comfort or delicious it. In arsenic also, they are having thirst for water but takes a little, and if takes somehow more, then it will be vomited out. So in arsenic and eupatorium, regarding vomiting after taking water is very much similar. But in arsenic we are getting much of prostration and weakness. In eupatorium we are getting much of bone breaking pain, and after taking water feeling more chilly, it invites chilliness and followed by vomiting. Now I am telling about chill stage of all four medicines: arsenic, bryonia, Rhus talks and eupatorium. Arsenic in chill stage, hardly patient feels thirsty, almost without thirst. If any patient is asking for water, that is for warm water, not cold water. Another important thing is very characteristics for arsenic, the alternating heat and chilliness. We are also getting these manifestations in eupatorium with different aspect of thirst. chill stage is being ameliorated by external warmth. Similar chill stage we may get in ignatia, but aggravation by external warmth of heat is characteristics for apis and apicut. During chill stage, arsenic patient generally drinking, but a little at a time, and drinking increases the chilliness and causes shuddering, nausea and vomiting. In this regard, once again, I am making comparison with eupatorium. Arsenic generally without thirst, if takes water, causing chilliness, shuddering, nausea and vomiting. But in eupatorium, they are feeling unquenchable thirst, intense thirst during chill stage. The character of thirst is very much different, but the latter part of the symptom, drinking water increases nausea, drinking water invites chilliness, all are almost similar with arsenic, but in eupatorium we are also getting bitter vomiting. Likewise, drinking water may also increase or invites chilliness. Capsicum is a very beautiful medicine. In case of eupatorium, we are also getting chilliness with excessive tingling and nausea from least motion. That also relates with bryonia. From motion, they are feeling nausea. Generally, chilliness in the morning, heat throughout the day, but no perspiration. Eupatorium actually is characterized by predominant chill stage, alternating with heat stage. Almost there is no sweat stage. In bryonia, in chill stage, they are very much thirsty, great thirst for large quantities of cold water, you all know, and taking water, they are feeling relief. In ignatia, we are also getting this symptom. In netramure also we are getting this symptom. Already I have told, in arsenic, they may take water but causes vomiting. In chill stage, bryonia patient may also suffer from violent cough, dry, racking cough with stitching pain, especially in chest. Dry, teasing, harassing cough before and during chill without pain. In bryonia, we are getting pain, chest with cough, dry cough with pain chest. They may hold their chest during coughing out of pain. But in Rhus talks, actually it is irritation in the throat, elongation of the alveoli causing irritation and annoying and irritating harassing cough, not that much of pain in chest, rather pain throughout the body or whole body. Generally, in Rhus talks, the shaking chill about 5 p.m. Even in warm room, they are not getting comfort, relieved by covering up in the bed. Nagzomika patient also very much chilly. When they covered up, they are not feeling relief. But in Rhus talks, they are very much chilly. But if they is being covered, they feel comfortable. And salivation is an important associated symptoms of Rhus talks in prodromal phase and also in chill stage. In arsenic, during chill stage, another important symptom, gastric symptom we are getting, tasteless taste of food. Or whenever they are moving about, arsenic patients, they may feel shuddering. That symptom we are also getting in Nagzomika. Patient feels very much chilly and shuddering whenever they uncover themselves. In arsenic, we may get also oppressed breathing, and in all chill stage, even in heat stage also, arsenic patient, physically they are very much frustrated and weak, but mentally they are very much restless. In bryonia, another important point I would like to incorporate, patients, those who are suffering from fever with history of getting wet, In bryonia, they may suffer from occipital headache rather from frontal headache as we are getting. In Rhus talks, cold hands, but heat and redness on the face, shivering, and chill and heat stage followed by perspiration. A shaking chill and going from the open air into a warm room. Characteristics cough we should not forget in the chill stage of Rhus talks, that is teasing, fatiguing cough with irritation in the throat. Not that much of pain in chest as we already stated in bryonia. But the characteristics feature we are getting in Rhus talks, they are very much suffering with annoying, harassing cough during chill, but during heat stage almost it is being abated automatically. Rhus talks patient is very much restless, and physical restless is much more well marked than mental anguish and restlessness as we are getting in arsenic. In eupatorium, chill may leave for a few minutes and return again, but no characteristics demarcation of heat of interval. In arsenic, we are getting chill stage alternating with a heat stage, clear-cut heat stage. But in eupatorium, chill stage is continuing with an interruption, not that of heat stage. Yearning and stretching is also present, and in eupatorium also they like to be covered very warmly. Chill invites taking water and bitter vomiting. All are very much characteristics in eupatorium. In that relation, we should recollect another name of the medicine is gelsemium, characteristic chill, especially in the back, running up from sinciput to occiput with great thirstlessness, drowsiness and dizziness. In heat stage, in arsenic, the thirst is more. That is insatiable, unquenchable burning thirst, but the drinking a little and often also leads to vomiting. So, we are getting repeated vomiting in arsenic patient during both chill and heat stage. The hot stage of the fever is very intense and especially long lasting in arsenic, and it is very dry, burning to the touch and with inclination to uncover. During heat stage, arsenic patient hardly preferring covering. But in bryonia, in prodromal stage patient was thirsty, thirst increased in chill stage, and it is further increased in heat stage, that is more than the chill stage. Cough is being continued with stitching pain, headache increased, vertigo increased, generalized pain all over the body aggravated by motion. There is internal heat actually. In bryonia, they are feeling internal heat as if veins was burning. That symptom we are also getting in Rhus talks. So in arsenic, in bryonia, in Rhus talks, in eupatorium, in all the four medicine, in heat stage, they are having good thirst, rather unquenchable thirst. In Rhus talks, general heat generally at 10 am with yearning and drowsy feeling, or particular subjective sensation of internal heat as if all veins are full with hot blood and feeling burning. But during heat stage, cough subsides. Sometimes we may get urticaria-like eruption breaks out over entire body, even in palms and soles, with violent itching when cough subsides in Rhus talks. during heat stage, the urticaria-like eruption in Rhus tox is very much characteristic, increased by rubbing, or may be continued in sweat stage also, with great heat and thirst, drinks a little, but lips is dry. Regarding urticaria-like rash during heat stage, I should mention another two medicine that is very important, Apis and Hipersul. In case of Apis, patient is thirstless except chill stage. During heat stage, no thirst. And urticaria appears as soon as chill passes off. In Apis, we are getting urticaria appeared as soon as the chill stage is passed off. Before and during chill, urticaria we are getting in Hipersul, both during heat and sweat stage urticaria we are getting in Rhus tox. And Hipersul is more chilly and having a sensation of oppression, especially behind the sternum, is a characteristic feature of Hipersul. In Ignatia we also may get urticaria-like eruption, but it is only during heat, not during chill, not during heat stage. In Bryonia, another characteristic symptom we should mention, that is the heat with desire to uncover in face with red face, with bitter taste in mouth, absolute inclination to lie down. In Eupatorium, during heat stage, nausea generally not appear, but bitter vomiting may present. But even during heat stage, if he takes water, then once again it will invite shivering and chilliness. Generally, Eupatorium fever paroxysm comes at forenoon or in the early morning and fatiguing cough. But the characteristics feature we should not forget for Eupatorium. Chill stage is predominating with an interval not so much characteristics of heat stage, seldom attendant with perspiration or sweat stage. Now I am telling about the sweat stage. In arsenic, unquenchable thirst, sweat with cessation of all the previous symptoms. When sweat commences on in arsenic patient, almost all the symptoms, all the complaints, whatever he is complaining, is being subsided. But after sweat stage, prostration and weakness may continue. In selected stage, there may be headache. In Bryonia, profuse sour sweat, easily excited by exercise in open air or exertion, even from slow walking, it runs in stream from his face. Profuse perspiration, free perspiration. Sweat followed by streams from whole body, even dropping from the hair. This is very characteristics. In relation to Bryonia perspiration, profuse sweating from least exertion, we should compare with sorinum and sepia. The least exertion puts him into a perspiration with loss of appetite and profound weakness, sorinum. In sepia, we are getting a beautiful symptom. Even while he is writing, the perspiration may break up. In Rhus tox, after heat stage, profuse sweat, odorless sweat, that is sour in Bryonia, and not so much exhausting sweat. Arsenic patient, after sweating with cessation of all previous symptoms, but prostration is continued. And in Rhus tox, sweating non-debilitating. Urticaria may be present during sweating stage, and when sweating stage pass up, the urticaria-like eruption may pass up. But in Rhus tox, another important feature we should not forget, sweat does not relieve all the pains. Even after sweating, pain may exist for few hours or 1 or 2 days. As we are getting after sweating, frustration is continuing in arsenic, like pain all over the body may continue in Rhus tox for 1 day or few hours. Already I have told in case of eupatorium, generally scanty or absent sweat, but headache may continue even after passing of the fever and sweating, if sweat present. When there is much perspiration and brings relief all pains except headache. Bone pains are present in every stage, only gradually disappear actually after sweat. But once again I am reminding you, hardly we are getting sweat stage, clear-cut sweat stage in eupatorium. Regarding concomitant, in eupatorium we may say the beautiful symptom we are getting, insipid taste, bitter food has no taste. In arsenic we are also getting no taste in the mouth. Now during apyrexia, in arsenic we are getting great debility and lassitude, weakness of the all limbs and mental restlessness. In bryonia, all symptoms of this stage are characteristic and should be carefully studied, but gastric symptom predominant. But general constitutional are almost to be found if present or guiding. Every spot in the body is painful to pressure. In Rhus tox, constant restlessness and cannot sit quiet, turns in bed frequently without finding an easy place. If fever does not abort it totally, even during apyrexia stage, Rhus tox patient may suffer from restlessness. In selected cases, we may also get fever blister on upper lip, not as purely as we are getting in nitromure. In bryonia, we also may get fever blister. In eupatorium apyrexia, we are getting bone pains that was present in every stage. When the fever has not been totally aborted, in those cases we should consider the apyrexia stage. The severity of vomiting has relation to time of eating. The nearer the meals, the surer to vomit, first of ingesta, afterwards of bile, which is usually bitter. In short, just I have elaborated the most effective homeopathic medicine as per individualistic approach come out in today's brainstorming discussion for last 1 hour, and I am happy to share my experiences, practical experiences in my clinical field, comparison and differentiation among the most effective homeopathic medicine, arsenic, bryonia, Rhus tox and eupatorium perfoliatum. In this connection, I do like to say, don't restrict yourself with only these 4 medicines. According to uncommon peculiar characteristic symptoms, rather according to morbid phenomena presenting symptoms and cause of the disease and effect of the cause, corroborating those, lots of medicine, different medicine may come, and as we have discussed in today's webinar, we got about 13 to 14 different medicine in selected cases. Rare medicine like Sabadilla, like sanguinaria also is being used successfully. Apart from that, in complicated cases, R-Cio, tuberculinum, sulfur, sorinum may also be indicated. Thank all of you for your patient hearing. Once again, I pay my thanks and gratitude to all the research persons, all the participants, my dear colleagues and friends, for being with the Bengal Academy of Applied Homeopathy in this webinar.